Hi everybody, Dr. Daniel Shanahan here from Legs, Foot and Ankle Associates. Thanks for checking out our latest YouTube video. As always, make sure you receive our latest content. Subscribe by clicking that button below, hit that bell icon to receive notifications. If you have a question you want answered, leave us a comment. We'll certainly get back to you as quick as we can. This video is about shoe anatomy, one of my absolute favorite topics to discuss with patients. There are so many different types of shoes to choose from, and unfortunately so many of them are detrimental to the well-being of your feet. The vast majority of shoes out there are designed very poorly and very cheaply and are more for fashion than they are for function. Unfortunately, too many patients think that if they spend a lot of money on shoes that the shoe must be good. That is hardly the case. Too often you are paying for shoes that are marketed well but not truly well designed for your feet. And remember, not all shoes are appropriate for every single foot type out there. So let's talk about the important aspects of shoe anatomy. First off, the top of the shoe, where the laces are, this is called the vamp. This area is critical to holding the foot stable on the platform of the shoe. A lace-up vamp is always better than a slip-on type of shoe with no laces or one with just a Velcro strap across the top. When you can tie laces, this will ultimately lock your foot onto the platform of the shoe much better. So let's talk about that platform or the bottom of the shoe. This area optimally should be rather firm, so it only bends at the ball of the foot region out near the toes, right out here. I regularly see shoes that fold literally in half due to being very flimsy and having a very spongy platform that really does not offer any support or control. The more firm or rigid that platform is, through the heel and the central arch area, the more control the shoe will offer. This control is important so there is less stress on the bones, joints, tendons, ligaments of your feet. In addition, the heel area of the platform should be just a little wider than the actual heel counter of the shoe. Thus, this will offer more stability to the foot when it strikes the ground. So that brings me to the heel counter portion of the shoe. This is one of the most important areas to have a degree of rigidity within the shoe. When you have a more rigid heel counter, this locks in your heel, so when you strike the ground, it will offer more stability to the entire foot and ankle region. Many shoes on the market I see have a very spongy, floppy heel counter area, and thus this does not allow patients to have any stability when they walk or run. Lastly, the area we call the toe box. This area should have enough room to accommodate the toes and the sides of the first and the fifth toe joints, so there is not too much compression to these areas. You also want the toe box area to have some depth and not be too tight across the tops of the toes. The way I look at it, the foot is a bag of 26 bones that all have to work in concert with multiple tendons, muscles, ligaments, and all the rest. If this part of your anatomy is not controlled or supported well, then we are far more prone to developing foot and ankle problems. So why not prevent those problems by putting good shoes on your feet, just like you would put good tires on your car so it performs well. Don't fall victim to the latest fad in fashionable athletic shoes, and certainly don't expect sandals, flip-flops, or high heels to provide proper, good function for your feet. If you want to learn more about the right shoes for your feet and how to prevent problems that keep you on the sidelines, call us today. Set up that appointment with myself or Dr. Petronella for expert advice. Don't waste your time and your money going to a generic shoe store and expecting a salesperson to provide you with any proper guidance as to what is good for your feet. We are the experts at teaching patients about their biomechanics and their anatomy so they can get proper shoes for their foot type. I hope you've enjoyed this video about shoe anatomy. As always, please click the link below to subscribe to our YouTube channel, hit that bell for notifications, or of course, leave a comment or a question, and we will be happy to answer. Have a great day.